Social media has normalized a whole lot of things, which are most times not even accurate. Now, not every tired man has low testosterone, and not every low testosterone video online is accurate. I know by now you'll be asking yourself, what is this testosterone? Testosterone is what? Male men sex hormone. It helps regulate what? Your sperm production, your muscle mass, your mood, your sex drive, and even your libido. Low
Yes.
testosterone, also known as what? Hypogonadism, is a diagnosis and not just a feeling. Now,
You
let's
don't
talk about the social media myths that have been outlined when it comes to what? Low testosterone. One, they always say when a man feels tired, that means he have what? Low testosterone. That's not always true because a man can be overworked, he can have anxiety, he can be facing depression, he can even have anemia or even thyroid problem. Fatigue or tiredness does not equate to what? Having low testosterone. In males too, when some people say low libido is equating to what? Low testosterone, that's not always true because reduced sexual desire can also be as a result of what? Depression and anxiety, some certain medication or chronic illness, or even what? Performance anxiety, or even what? Relationship stress. Yes, I know that low testosterone can be a cause, but it's always not a cause. Three, some people say that you can diagnose low testosterone by only what? Symptoms. That's not medically accurate because true diagnosis require what? Blood test, which can be done in the morning because what? Your testosterone is what? Higher. And sometimes you even have to what? Confirm it. Symptom alone does not what? Give diagnosis when they have to be what? Low testosterone. You need test. Now let's talk about the real symptom, the real concerning symptom when you have to do with what? Low testosterone. Now your doctor can be what? More concerned when you have what? These symptoms persistently, like what? Persistent low libido, erectile dysfunction, reduced erection in the morning, infertility, fatigue, like always tired. Yes, these symptoms can what? Be more what? Concerning when you have to be what? Low testosterone. But even after all these symptoms, you still need a what? A test, a blood test to define you have this diagnosis. Symptom is still not enough, even though they are real symptoms and not just by what? Tiredness and fatigue. I want
which
you
can be
all to
used.
hold your ear when I tell you that you can't just start taking testosterone supplements just like that, casually. Just because you feel that you're having these symptoms I mentioned, like these real symptoms, you just start taking it like that. That's not proper because it can expose you to what? Cardiovascular risks to some people. It can do what? Suppress sperm production and also what? Affect fertility. You don't just take it like that casually because you think that you have this what? Real symptoms. You need proper medical what? Monitoring. I know
Please
social
no.
media has raised a certain level of awareness. I'm not debunking that, but it cannot replace what? Proper diagnosis. The best thing to do when you're having this concerning symptom is to go to the hospital for what? Blood test and medical evaluation and not self-treatment. Till next time, follow all the NACA summary for simple, educative health education. Till next time, toodles.